Welcome, and we will be doing a NG insertion or NG tube insertion and a stoma care or ostomy care today. First thing we're going to start with is the NG tube insertion. First thing you want to do is review your orders, and then gather your supplies, and then once you have all that ready, you're going to go into the room, perform your hand hygiene for 30 seconds, introduce yourself to the patient, make sure you have the right patient by doing your 2 patient identifiers. You're going to explain to the patient about the procedure you're about to do, and then once all that is out of the way, make sure you provide privacy also. Raise the bed, lower the bed rail, whatever side you work on. And once all that is done, you're going to assess the patient's cough and gag reflex as well. Once you've assessed the cough and gag reflex, also make sure if they're NPO or not. If so, then have ready a cup of water with a straw. We'll use this for right now. Just so this swallowing, because swallowing facilitates the insertion of the tube as it goes down. But, now that I've explained the procedure to my patient, I've identified my patient and everything, next up, I'm going to position them in high Fowler's position. Also, make sure you assess for any latex allergies. But position them in high Fowler's position, and then, you already washed your hands. You're going to put on your clean gloves. Oh, these are tight. There we go. So you've performed hand hygiene, got your gloves, introduce yourself, identify the patient, explain the procedure, assess the cough and gag reflex. Also, make sure you get a tongue depressor, and that's what you're going to use to assess their gag reflex. Also, while you're at it, use your pen light just to inspect their mouth or their oral cavity. While you're at it, use your pen light as well to assess their nares. Make sure that there's no breakdown of the nares. And then you would also have them hold one nare or the other, see which one they, breathe best through, just to know which one you're gonna put the NG tube in through. But now you've got all that out of the way. You're gonna grab your supplies. First thing you're gonna do, you're gonna grab your NG tube and you're gonna measure it. So the rule of thumb is when measuring the NG tube, you will measure from the tip of the nose to the tip of the ear to the xiphoid process. Unfortunately, Mr. Hendricks here does not have any ears or xiphoid process. So we're just going to pretend, we have the same body. So I would go from the tip of my nose to the tip of my earlobe, and then down to my xiphoid process, which is right about here. And so the result is about 41. You're going to grab your tape, tear off a tiny piece, and use that as a marker so you know when to stop when you insert the tube. Once that's done, you're going to lubricate the first 4 inches of the tube with a water-soluble lubricant. Make sure you have your emesis basin nearby in case, they gag too much and have to throw up. But you've got your 4 inches lubricated with water-soluble lubricant. And then you're going to have them already in high Fowler's position, have them hyperextend their head, and then just tell them, take a deep breath, relax. If they're not NPO, then have them take a sip of this water as I put it in. I'm just going to need you to swallow, as the swallowing helps ease that tube through. And then you simply, once they're ready, on the count of 3, 1, 2, 3, you're going to just tell them, swallow, 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 swallow. You're doing great. You're doing great. We're almost done. And we are there. You're going to stop at the marker. You're not going to force it. If you feel like you're forcing it, then pull it back out. But once you've stopped at the marker, you're going to hold it right there. You're going to grab your other piece of tape. You're going to make it look like a pair of pants with this tear down the middle like that. And then you're going to put the top of it on the edge of their nose. Grab one leg. I don't know if you can see. You're going to wrap it around the NG tube. Same thing with the other leg. So now it is secure. You're going to gently tug on it. You can't pull it out. Unless you really, really, really try it. But you can't accidentally pull it out. So once the NG tube is secure, assess your patient, see how they tolerated that. Are you okay? Do you need more water? And then if there's an order for suctioning, you would attach this end to the suction and leave this to open air. If there is no order for suctioning, then you should just loop that and connect it just so it's closed. And lastly, the gold standard to make sure that it is in proper placement is having a chest x-ray done. Some hospitals still do pH, but most hospitals, the gold standard is getting that x-ray to make sure it's properly placed and it's not in a lung or anything else. Once all that is out of the way, you lower the bed back down, put the rail back up, make sure the call light is within reach, assess them again, let them know when you'll be back, and go document. And of course, take off your gloves. On the way out, you wash your hands, perform hand hygiene for 30 seconds. Also, importantly, before I forget, what you want to do is you want to grab, here it is. You want to grab your tape. You want to tear off this big piece. And you don't want any tension on this NG tube. Leave some clearance for them to move their head around. Wrap it around the tube, and then use a safety pin and safety pin this to their clothes. If not, they may accidentally pull it out. That way, it's more secured. And once that is done, then you do the x-ray to make sure it's properly placed, and documentation, hand hygiene, lower the bed back down, patient safety, etc. But we're going to keep going with this demonstration. Next step, we are going to remove it. So for the removal, as always, make sure you check your orders, identify your patient, explain the procedure, perform hand hygiene, put on some new clean gloves, not these, but I don't want to waste any more gloves. Explain the procedure, place them in high Fowler's position, and have a emesis basin again ready in case they gag or throw up. Also, have some water for them after if they're not NPO. And then once you've explained everything and you're ready to go, you just gently pull off the tape. You want to pinch it so nothing comes out spraying. Pinch the tube, gently pull off the tape, and just on the count of 3, tell them 1, 2, 3. All right, we're pulling out, pulling out, pulling out, pulling out, pulling out, pulling out. And there you go. Pull it out, properly dispose of it. You assess your patient, ask them if they're okay, see how they tolerate it. If they need water, give them a sip of water. If they can't have water, just to make sure, just to help them relieve their sore air passages. But aside from that, after assessing them, you just go document, perform hand hygiene on your way out, lower the bed, put the bedroll back up, give them the call light, all that patient safety, and then perform hand hygiene and document, of course. But that's that on the NG tube insertion and removal. Now, next up, I'm going to remove it for this part of the demonstration. Next up, we have our stoma, which does not want to stick. Excuse me for that. So we have our stoma. Hopefully it sticks. Now, as every other procedure, you will review your orders, introduce yourself, identify your patient with 2 identifiers, explain the procedure, assess for any allergies, and then once we've done all that, perform hand hygiene, put on a new pair of gloves again. Once we've explained everything, make sure they're a supine or semi-Fowler's position. And then if they have a bag already on, you're going to just gently press the skin and gently pull it off. Or that's if it's empty. If it has any stool and you need to empty the stool, remove the clip, pour the stool out into whatever container, basin you need. If you need to measure it for any I&Os, or if you need to, observe the stool quality or the quantity for documentation, then of course, you pour the stool out into whatever container you need, and then you pour it down the toilet. Regardless, once you're done with that bag, if it had stool, you throw it into the biohazard. And since you already removed it through the bag into a biohazard bag, you take off your gloves, wash your hands again, and put on new gloves, because you would not touch your face or anything else if you just got done wiping your butt, right? Of course. So, we remove the stoma, and now we're gonna assess the stoma. Make sure that it's red or pinkish, fleshy colored, and make sure that it's not necrotic or infected or anything like that. And then you're gonna want to do a cleaning of the stoma. So you're gonna grab a washcloth, and then you're just gonna gently clean the stoma around. Once you've cleaned it, you're gonna grab a regular dry cloth and just pat dry it gently. You don't want to be too rough on this because it's open, exposed skin, and it's sensitive. Once it's cleaned, assess it like I said, and then you're going to measure using a measuring device, which usually most hospitals have a device or a sheet that has pre-cut holes in it, so you can place over the stoma and see how big it is. Unfortunately, I couldn't find mine in my kit, but I measured this specific stoma prior to this demonstration, so I know what size it is, but in the real setting, you will use the measuring device to make sure. Once you've measured, you will grab your wafer, open it up. After measuring, you want to make sure it's about 1/16 of an inch bigger than the actual stoma, just to leave some clearance for the stoma. You don't want to get this stuck on the stoma because this stuff is really sticky, and it'll hurt if you stick it on there and then have to pull it off. So we are going to cut our wafer for the appropriate size. Okay, so there we go. We got the right size. It's clean and dry. Patient's still doing okay. We pull off the backing, off the adhesive. And you will simply just boom, stick it on there. Just like that. Make sure it's stuck on there good. And then you're gonna grab your ostomy bag, fresh new ostomy bag, and just line it onto the plastic so it clips into place. just like that. There we go. And then you have a fresh new ostomy bag. Lastly, just make sure you clip it. You don't want, you don't want their poop spilling out. They don't want that either. It's embarrassing. They'll probably be mad at you. You grab your clip. Make sure you clip it, just like that. You fold the plastic and then clip it over the fold, and there you have it, fresh new ostomy. Lastly, you lower your bed back down, put the rail back up. You assess the patient, see how they tolerated that. If they tolerated it well, let them know when you'll be back. Put the call light within reach. As you walk out, take off your gloves, perform hand hygiene, and make sure you document everything you did.